prescription medications, new and improved is not always new and improved. So what's your opinion on new drugs versus older drugs?
Well, you're exactly right. The pharmaceutical industry in this country has a tremendous lobby. That's not to say that the pharmaceutical industry hasn't done great things for patients in the United States and all over the world. But let's face it, newer drugs have to be paid for in terms of their research and development, their marketing, so on and so forth. So that money has to come from somewhere. So new drugs are being pushed on patients in many cases where older drugs would have done the job quite well for a lot less money. A perfect example is hypertension. Hydrochlorothiazide is a simple diuretic that's been used for 40 or 50 years in people with high blood pressure, and many studies have been shown to be as effective as some of these newer antihypertensive drugs. So this is part of the problem.
Well, and I think there's also the politics of the drug companies, as you say. Some of the drugs, they will make a slight tweak. If they have a drug that's going off of patent,
right,
then they will make a slight tweak so that they can
re-up it for,
right, re-up
exactly.
it, new price before they have generic competition and generic price competition.
Exactly. Now it's important to realize that in the United States, 85% of prescriptions are generic. So you would have thought, well, that's going to save me money, isn't it? But no, that's not the case, and here's why. In the generic drug industry, there's been a few big key players that have bought up weaker companies. So I'm afraid to say that the drug industry in the US is kind of a monopoly. And when you control drug prices because you're largest player in the market and you can call the shots, the patient suffers. For example, there have been drugs that have been 40 and 50 years old that have increased 6, 10, 20-fold, say for...
Well, they had it with insulin recently.
Right, and they had it with the EpiPen.
Mm-hmm.
There was a treatment for toxoplasmosis, which is a parasitic disease. The pill price went from $13 a pill to $760 a pill. Why should this be? This drug is easy to make, but, when competition gets pushed out of the marketplace and you have these big players, they can call the shots.
So what's the self-defense?
The self-defense is to ask your doctor, and he or she may not know the answer, is there a cheaper drug that will do the same thing for my problem? That's number one. Perhaps the doctor doesn't know the answer to that question, so you have to do your own research. The other thing is to talk to your health plan. I know that many large health plans like Kaiser Permanente have been able to negotiate lower drug prices because they're so big, and they have the power to negotiate better prices for their members. So I think, talk to your health plan and see if there's a pill or medication that can take care of your problem the same way, but for a lower cost.
Right. And now let's talk another aspect of new drugs,
okay,
which is safety.
Yes.
That they haven't yet necessarily had long-term testing.
Exactly.
And testing in the full, complete marketplace.
Yes.
On a new drug.
Well, we see so many commercials on television that are sponsored by law firms that if you or a loved one have been treated by drug
mm-hmm.
X and experienced any of the following, call us. Well, those ads are not there for no reason. They're there because there have been drugs which were thought to become big blockbusters for drug companies, only to be found to cause big problems for patients down the line.
Right. Vioxx was a big issue years ago, one
exactly.
of the painkillers.
That was a very big
right.
one.
But in general, these drugs, they're tested in the lab. They might be tested in human trials,
right.
but in limited groups
yes.
and for limited amounts of time.
But there's also
right.
been drugs that have had falsified data, too.
Yes.
And so because of the money that a company's invested in research and development and marketing, and they found that the study showed that it had a certain danger, such as in the Vioxx situation,
right.
drug companies were willing to take that risk and take the money up front and fight the lawsuits down the road, allegedly anyway. So that's a big problem.
Yeah. So back to what you actually said earlier, which
right.
is that ask the doctor, what can you not have a drug at all, or what's the lowest dose or the least risky
right.
medication?
It's best not to have the drug
take.
at all.
Right.
I mean, if you're very overweight and
right.
you're being treated for hypertension or diabetes, right. losing weight will often cure your problem.
Huge difference, right?
Right. And it's not easy to do,
Right.
but it's worth trying. The second thing is, okay, I'm taking a drug, say, for blood pressure, but I heard that this older drug that costs about 25 cents a pill or 10 cents a pill, in studies showed about the same response. Can I do that?
Right.
So,
And again, you really have to push your doctors because there are so many drugs out there that it's hard for them to keep up on the news.
exactly.
Yeah. All right, complicated issue.
It is.
Right. Thank you, David. If you like what you just saw, do me a favor, share it. The healthcare challenge is really a problem for all of us. And the more we can get this information out and get people taking better care of their health, the healthier we will all be. We have more videos with Dr. Sherer as well as his blog, What Your Doctor Isn't Telling You, at our website, bottomlineinc.com.